Hello, I'm Kenneth Cutbush, an orthopaedic shoulder surgeon working in Brisbane. I'm with Lucy Angelini, a shoulder physiotherapist. Are you staring down the path of a shoulder replacement surgery for an arthritic shoulder? Well, we're going to talk about what's in store for you after that operation. What is the shoulder rehab for someone having an anatomic total shoulder replacement? So in shoulder replacement surgery, there are two basic categories of shoulder replacement. One is reverse shoulder arthroplasty and the other is anatomic total shoulder replacement. Anatomic is the classic shoulder replacement. It has largely been replaced by reverse shoulder replacement surgery. Reverse just means the ball and the socket are reversed, so it's a reverse. And in Australia, 80% of all shoulder replacements these days are reverse, with about, not quite 20% an anatomic total shoulder replacement, because there are other variations as well. But anatomic is a very important category of shoulder replacement surgery, and the rehab is different for the anatomic compared to the reverse. Certainly it is for me. One of the big differences is just the time you're going to spend in the sling. For reverse, I will typically recommend 3 weeks in a sling, whereas for an anatomic, we have to protect the rotator cuff across the front of the shoulder, the subscapularis part of the rotator cuff, after that operation. And for an anatomic, you have to have the subscapularis to get a good result. So it's got to be protected and allowed to heal. You'll be in a sling for 6 weeks full time, and between 6 and 12 weeks, we will be slowing down your rehab compared to, say, someone who's had a reverse, because we need to make sure we don't tear that rotator cuff repair. You need your rotator cuff intact for an anatomic. You don't need it intact for a reverse shoulder replacement to get a good result. So that's the big difference. So this is an open operation. Typically with me, you're going to be in hospital for 2 nights after the operation, and you'll see the physio the day one post-op. You'll also, in my care, going to have a CT and X-ray that day to make sure the prosthesis is in the correct position and to give us a baseline to measure any changes in the future from. So that first morning, day one post-op,
Yes.
physio comes to see them.
Yep.
What are they in store for?
So we're going to show you how to take the sling off and put it back on independently. We're going to talk to you about important things like being able to have a shower, getting dressed, the best way to put on a shirt, that kind of thing. We're also going to show you some exercises to do. So there'll be passive range of motion exercises for the shoulder because we're protecting that rotator cuff repair. So we're passively moving the shoulder, not moving it under its own steam. So we'll be doing a gentle pendulum, just letting your arm hang away from your body. And that's useful because then you can have access to your armpit, which is important for cleaning and putting on deodorant. And then we'll also do a passive stick external rotation. So using a stick to stretch your arm out to the side because you'll be in an internally rotated position in the sling. And then we'll also be doing some active range of motion for the adjacent joints, so that making sure your hand and your elbow and your neck don't stiffen up as a result of being in the sling. So that's the main things that we go through.
And take some time to go through with your physio that sees you on the ward in the hospital, how to put the sling on, how to have a shower, how to get dressed, how to do all those things safely. They're on my website, and we've done little videos there, so you can go and reference that. But it's good to go through it with the physio in hospital. They'll see you the day one post-op and then day 2 post-op before you discharge. Now they're going to have a sling.
Yes.
Now, most patients will have a bolster, but some patients will be more comfortable without the bolster, in which case the bolster can come off and just come across the side. And when do they see their physio after they leave hospital?
So normally you'd see your own local physio at about 2 weeks post-op, and that's to check the wound and make sure that's going okay, to make sure there's not too much swelling in your arm, and also to review your exercises because there's a lot going on in hospital in those first few days, so it's nice just for a refresher. But to make sure that you're not using the arm for too much, you're just resting it in the sling, letting it heal, and that you're comfortable enough post-operatively.
Yeah. And then we will see you back for the first visit at 6 weeks. Yes. What are we doing then?
So at 6 weeks, you get to come out of the sling, which is exciting. And we transition from doing passive range of motion exercises to active range of motion exercises. So starting to move the shoulder under its own steam and getting your range of motion back. So the phase 2, week 6 to week 12, is about getting your shoulder moving,
but keeping that rotator cuff repair intact.
So we're really careful not to load the subscap. So things like opening a door, pulling the doona up at night, things where you're pulling your hand in towards your body, we have to be really careful of.
Yeah, so don't do them. Because you do need your subscapularis. They can tear, and they do. And if that happens, you won't be totally happy with your shoulder. And if you're really unhappy with it, you'll be talking about revising the shoulder replacement fairly early, and it goes to a reverse. So that's the big difference in the rehab between the anatomic and the reverse shoulder replacement. And these visits can be done by telehealth, can't they? They actually work
Absolutely.
quite well.
Yeah.
In fact, surprisingly well.
Yeah, we're very good at communicating with your local physio. Oftentimes people will do it from their local physio's office, so we can all talk together, all answer questions
so
together.
that does work pretty well.
So that we're all on the same page, because every surgeon has their, differences in protocol, so it's really nice to be able to get the information you need.
Yeah. And then the second visit is at 12 weeks. What are we doing that 12-week visit?
At 12 weeks, we're looking that your range of motion is returning. Oftentimes it won't be full, but that it's progressing, that your pain's under control, that you're functional in all your normal day-to-day activities. And if all that's going well, we start some strengthening.
Yeah.
Yeah, so we start to load. At 12 weeks, we're allowed to start loading that subscap. So we'll start probably with some banded exercises for your rotator cuff, and progress to, talking about what your sporting and work sort of goals are.
Yeah, getting their life back.
Getting their life back. Back to the things they enjoy.
And by that time, they're normally sleeping and things are a lot better, aren't they?
Oh, absolutely. Yeah. A lot more comfortable.
Yeah. Now, for me, the next visit will be typically at 12 months. Sometimes we'll see in between that time, but often it is the next visit, it's 12 months. What are we doing at 12 months?
So at 12 months, we're having a look to make sure that you're able to do everything you need to do, fill in any little gaps that might be there, but taking a video of the range of motion, so making sure that's appropriate, and also testing your strength. So we use the dynamometer to test your strength compared to your contralateral side, and adapting your program for any gaps.
Yeah, I mean, at this point, from my point of view, I'm thinking about pushing it down a strengthening pathway. And the other thing I often see is that the scapula's not moving as well as it could.
Sometimes
and that's often a big contributor to not getting fully up overhead, in which case we're pushing into some physio.
Exactly, yeah. Sometimes they're lacking that last little bit of range of motion. And oftentimes that's because it's not, really something that they do or need, but we want them to be as good as they possibly can.
And we're getting a CT and X-ray for a final check to make sure the prosthesis is correct, that it's well incorporated, and that you're well set up for a good result long term. We're not expecting any problems. So that's an anatomic total shoulder replacement and what's in store for you after the operation. I think the only thing to mention is we like prehab leading up to that, don't we?
Absolutely. The stronger you are going into a sling, the better you'll be coming out of it.
Yes, we like to see the physio before the surgery so that you know what to expect afterwards in terms of range of motion. It prepares you well for it. So thank you for listening.